dedicated to the future of public hospitals. And with this stimulating introduction of our minister, I would like to start with our panel. First of all, I would like to thank Cyprus Forum and specifically the founder of Cyprus Forum and congratulate him, Nicolas Kyriakidis. And of course, I have to admit that I feel not only a great pleasure, but also a great honor to have the panelists nearby me. So, we will talk about the future of public hospitals. This is a very blooming, I suppose, and really stimulating issue. And most of us, we know that historically, healthcare systems have been hospital-centric. Currently, we are facing a more transitional, I would say also transformational environment in the healthcare sector, shifting from fee to service into fee for value. So we are talking currently about a new era in the healthcare sector, a value-based medicine or consumer-based medicine. We have actually three words that we need to take into account: value, accountability, and sustainability of our public hospitals. And with this small introduction, I would like actually to introduce our first speaker, Mr. Marios Panayides, who is actually the chairman of the State Health Services Organization. And actually, Mr. Panayides, focusing on these words, value, accountability, sustainability of our hospitals, I would like to ask you, how do you envision actually the future of the public hospitals in Cyprus, taking into account the changing environment that we are facing currently with the advent of YESI?
Okay, Dr. Pana, thank you very much. I would like also to thank Cyprus Forum for the invitation. It is true that we are experiencing a cosmogonic change in the hospital sector, in the health sector, and the public hospitals are in the center of it. What I would like to say, first of all, in this important reform, is that as we see in many health systems all over the world, there is a coexistence of public hospitals with private hospitals. So therefore, this is a long-term game for us. We are looking into the future as to how the public hospitals will develop through this reform. It's a twin reform for us. It's the change of the health system through YESI and also the autonomization of the public hospitals into the organization, SHSO or OKB as we call them in Greek. So it is important that the public hospitals also reform themselves. And this will happen gradually. It is it's a process that already started. It is a process that already started also with the organization of the central structure of the organization, which is still an ongoing project, expecting that this will be finalized to a great extent by the end of this year. And we see that the public hospital have a central role to play within the overall health system. Not only because they are responsible for the provision of public health, because this is only the public hospital can play this role, but also because the public hospital have to improve the services that they provide. We are now, the transformation all over the world, but this is more important now in Cyprus, will lead all the hospitals to become patient-centered, to offer patient-centered services. And so far in our hospitals, it has been, the patient was a given, because 60–70% of the patients had to come to the public hospitals. This, of course, has created a great expertise in our doctors, which we need to demonstrate and make the public aware of this expertise so that we convince them to be, not, I would say, the first priority in their mind, But we need to change a lot of other things in the way we work, the hours that we work, and certainly the mentality, and many other things to make the experience of the patient more pleasant coming to our hospitals. But this is something that will change in the short to medium term, I would say. In longer term, it is very important that for us, that the public hospitals will enhance cooperations with the universities. This is a key strategic development for us, and already we started forming agreements or enhancing the existing agreements that existed, because creating university clinics, enhancing education, and giving a primary focus on research, these are key pillars in addition to, let's say, enhancing the quality of services provided in getting our let's say, key role in this sector, which should be a leading one. Of course, I need not remind again the offering of public health, which is something important. This has been demonstrated with the facing of the pandemic. Nobody else can offer these health services during such pandemics and similar occurrences. And of course, we have to offer services where other hospitals do not find it economically viable to do so. So this is our role is key, but it's not only for public health. It's for offering a full spectrum of services and a full spectrum of high-quality services. And I see this as a key for the long-term success of the public hospitals maintaining their leading role.
Of course, I have to admit with you, and based on your experience, would you tell us two of the main challenges that probably you will face eventually in the future through this transitional phase with focus on public hospitals? It would be the autonomy, as you said, the engagement, this behavioral change that has actually to be present through all the providers?
There are many challenges that we are facing. There are many challenges that we are facing also because of the system of the health services organization that due to the change in the market of GSE. First of all, it is very important to secure this health system is a managed system. It's not an open market system where it will foster competition. This is welcome, but the health services organization should ensure that the infrastructure available and the capacity of the market that is not fostering over capacity in the market. So first of all, it is very important in our discussions with HIO in this respect for HIO to take into consideration the existing infrastructure in all aspects, not only clinics, but also the emergency departments in the ambulance sector and others, that they take into consideration what is available in order not to create over competition. So one aspect in this, I think this is a key aspect, and this is what we are trying to achieve. And also, I believe it is very important to enhance not only ours, but also how the primary health care system is now working. The primary doctors, the personal doctors are the entry to the ESC system. It is very important for us to ensure that this system works very well. Of course, there are problems now at the beginning, but the primary health care will add value to the overall GSE. I think I have discussed a lot of the issues about the public hospitals. We need to rise to the occasion so that that the health system works, and this entails many aspects. In addition to the organization centrally, we need to ensure that to do many changes in the structures of the hospitals, in the management structures, to create more vertical structures. We need to change the way we work, answering the phones, in booking appointments. We need to be able to work with what the patients want.
I think
the hourly.
You're giving me now a very important, let's say, point regarding the structure to move forward actually with our second esteemed speaker regarding the organizational core competencies. So we have Mr. Stavros Malas, who is actually the former Minister of Health, and he is also a professor of genetics at the University of Nicosia here. It's really a pleasure and honor to have you here.
Pleasure.
So discussing about the structures and discussing about core organizational competencies. I tried to review the literature, but also the experience from other countries. And one of the main pillars is also data management, data collection, data capture. What is your opinion about that?
Sure. Well, first of all, I'd like to thank the organizers for giving me the opportunity to discuss this very important reform. Before we discuss this, we need to put in context the mission of the hospitals, the public hospitals, in relation to what we're actually doing in Cyprus. We are actually trying to achieve something that has been done before in any other European country. In other words, to have a financial engineering and an engineering of medical services with two very dissimilar sectors being under the same umbrella. One for profit, which is the private sector, fragmented in many, many small businesses, and being 3 times bigger in terms of size of doctors than the public sector. So this is really a big challenge. It is a challenge in how we engineer financially the system. That's the easy part. It is a challenge how we deliver the healthcare sector. It's the other part. And this is where we need to really focus and ask the question, what is the role of the public hospitals in general? Are they the backbone of the system like in any other European country? The answer is no. We have not engineered the system initially to safeguard and secure that the public hospitals will be the backbone as they were before. So that is number one. So having that in mind, and I really do not envy the job of Mr. Panayides to actually be able to do that, because he has another 3 years before the government subsidy runs out. So the second part, in parallel to actually defining the role of the public hospitals, is now to see from purely the medical perspective how we engineer their services so they become the backbone. In other words, they become the hospitals of preference. And this is where I think we need to invest in reference clinics. We are a very small country, and the way we engineer the delivery of healthcare services is fragmented, massively fragmented. And we have a professor of public health, Pastides, listening to this. And in any public system, public health system, you must have channels diverting patients to doctors that have critical mass of patients. We do not do that, and I think this is a challenge for the public hospitals. To build on that, we can now engineer clearly systems of data management, because if you're fragmenting patients, you're not going to be able to create that critical mass of patients to be able to analyze data for a small country that is critical, because small countries, and particularly geographically isolated countries like Cyprus, do have certain idiosyncrasies, medical as well as social, that come out when you dig into this data. For instance, we know that from cancer. We have very high rate of thyroid cancer in women, and we don't know that. It's the highest in Europe. So those are, I'm just giving that as an example without causing an alarm, but that is the case. So I see the role of the public hospitals, in engineering health services as being pivotal. at this time point. And if we don't do this, then we're going to miss not only the opportunity to create a value-added system, which is what you actually very nicely highlighted, but also engineer the system that eventually is not going to be patient-centered either. So that's...
Professor Malas, I agree with you. But since Cyprus is a small European country, is this an opportunity actually for me to have some small, smart hospitals actually where we can build on interconnection of an integrated ecosystem, irrespectively if it's a public or a private sector?
Absolutely, yes. But you know, we cannot deny the fact that the business model does affect what you do.
Yeah, of course.
And if you marry the two, and you know, I always bring the example that if you have a marriage, you cannot have the groom wearing, you know, sort of a very expensive costume and the bride wearing something different and not of equivalent, you know, value. So you really have to have an equivalency in the system. But I do agree with you that if we integrate the provision of public health through the creation of the medical schools, for instance, which is an opportunity for public hospitals to really upgrade their learning and also lifelong learning of their doctors and create synergies across clinics, that is a way to go. And we've done this with one hospital that's actually a very good example of doing that, is Makarios Hospital. Makarios Hospital is the only true reference clinic in Cyprus, along with the Institute of Neurology that is no longer a reference hospital, unfortunately, under the system. But Makarios Hospital is, and we've tried and done that within Makarios Hospital, that is to really diversify and interconnect clinics, even with clinics abroad. And that really gave us the opportunity to bring out data that we're not aware before, particularly for pediatric diseases. Yeah.
Thank you very, very much.
Thank you.
You know, as a pediatrician, I have to agree with you, but I have to move forward also with our esteemed speakers that are currently remotely with us. So I will move forward with Professor Haris Pastides. It's actually a great honor to have you with us today. Professor Pastides, he is the president actually of the University of South Carolina. So I have to ask you, since I know that you are a professor also in epidemiology and statistics, again about accountable organizations. So I know that in the United States, accountability is a major issue for the hospitals currently. And I would like to hear your opinion and also your experience regarding that issue, bearing in mind also the introduction that we said that we are facing worldwide a transformational change in the healthcare sector where we put actually more importance on patient outcome value, value-based medicine, patient-centered care. Could you please comment on that?
Yes, good day to everybody at the Cyprus Forum. It is a pleasure to be with you as a Cypriot American early in the morning on the East Coast of the United States, to be with the distinguished panelists and with all of the audience as well. Let me first say that these transformations are happening in the United States as well. Even with all of the other important problems that we face, including the pandemic and social justice, the economy, American voters still view healthcare, the accessibility of healthcare, the organization of hospitals as one of the primary issues that will influence their voting. Cyprus, of course, is undergoing a transformation with the public hospitals moving from more direct supervision in the Ministry of Health to the State Health Services Organization, which provides a great opportunity, but also, I would say, a threat. I will tell you that in the United States, it has been 10 years now since the mandate of accountable care organization. And I think the final analysis of what they been successful or not is not adjudicated yet. There are about 600 ACOs, as we call them, in the United States. And their premise is that we reimburse by value, not volume. But do they really save money and increase the quality of care for the patient? It's important for Cyprus to learn both from the successes of these ACOs, but also from their failures. Let me give you just one example of how an ACO could work to improve value. As we know, when the Food and Drug Administration approves a new drug, let's say for a rare cancer, a physician can prescribe that drug for any indication whatsoever. And in trying to cure and treat advanced cancer, physicians often reach out to try novel drugs. And while we don't want to restrict the physician's ability to choose the right drug for their patient, the ACOs bring a data-driven and scientific approach to whether there is scientific evidence that the drug that is being prescribed will be able to improve the outcome for a patient. Now, physicians don't often like these restrictions, but the truth is that there can be inordinate expense and not the increase in benefit to the patient by using drugs for which there is no scientific evidence of their worthiness. I want to agree with Dr. Malas, who indicated that data analytics, data sharing, and also the relationship between, I think, the academic community and the public hospitals is most important. The accountability and the improvement of value will not happen unless there is immediate access to the results and the interventions of the accountability standards. And so, in summary, I would say the devil is in the details. The State Health Services Organization has the right approach to move toward value and improve patient outcomes. But the real question is, how will this happen? The ideology is excellent, but in order for the practice to follow, there will have to be a structure. And depending on what structure is given to the hospitals, I believe this move toward accountability will either be a great success or will be fraught with difficulties.
Thank you very much, Professor Pastides. And now we have to move forward to our last but not least, Professor Natasha Azzopardi-Muscat. It's really a great pleasure. She's the director of the WHO Division of Country Health Policies and Systems. So I will move directly to my question to you. What is actually the role of your division regarding the future of public hospitals, especially in small European countries like Cyprus? How can you contribute to help to this initiative and this transformation of the public sector?
Thank you very much, and thank you for inviting me to join this forum. Prior to taking up my role in WHO, I was actually working for 2 decades at the Ministry of Health in Malta. And my academic area of interest is small state health systems. So I think the first thing to state is that we have to be very careful when transposing forms and practices from larger countries into a small country context. The second is that Cyprus, not very unlike the Maltese health system, has quite an independent and parallel private sector. And I will now turn a little bit to our European program of work and explain how I think this can be helpful and supportive also for Cyprus going forward in the coming months and years. Just a couple of weeks ago, the regional committee unanimously adopted this program of work. And in the program of work, of course, we focus on the 3 pillars of work of WHO. The first of which is improving coverage, universal health coverage. And I see very much that the efforts that you are undertaking in Cyprus go really in this direction. The second is to protect people against health emergencies. A year ago, when we first actually started thinking about the European program of work, we thought that this was perhaps not such a big issue for the European region, for Western Europe. COVID-19 has changed our perspective absolutely on this and has brought to the fore the weaknesses of health systems in Europe, which perhaps us as experts knew about before, including, for example, what I have really heard previous speakers highlighting, fragmentation. The fragmentation issue has been one of the issues that has been brought out in our analysis as having led to the inability of countries that are relatively wealthy, for example, to organize and govern their responses as well as possible. The third pillar, of course, is about the health and well-being. And I think looking to the hospitals of the future, and if you are now in this really unique opportunity where everyone has to make changes following the lessons that we have learned in the past months from COVID, but if you are actually already in a process of change, there's a real opportunity for hospitals to be better linked to each other. And for a small country, inevitably, one has to look carefully at the number of hospitals, but also the bringing together the minimum volumes that are necessary to ensure and ascertain quality. This brings me to data and information. And here, small countries really have an opportunity. Just look at Estonia. And in Malta, we are not far off too. The remaining challenge is still to find better ways, although we have made steps, to integrate the private sector. And here, maybe you will be pleased to hear that one of the 4 flagship priorities identified by the regional director is, in fact, digital health and digitalization. And I think over the past months, we have seen such huge strides that have been made in this area that us as policymakers who have been trying maybe for the best of 10 to 15 years to bring about transformation in hospitals and our systems through digitalization and facing a number of barriers, these barriers somehow disappeared, some of them overnight. And we have really an opportunity now to understand where has digital health services, where have they worked effectively without compromising on quality? Where have patients found that this brings the services in their own home, at their workplace, in a way that doesn't expose them to other illness, particularly for people who are already vulnerable with chronic illnesses, the elderly population. On the other hand, we know where they haven't worked so well and where the health workforce and the human touch remains so important. And over here, I was also very glad to hear about the links between hospitals and primary care and the academia. One of the things that we are worried about, even with WHO, is the future of the health workforce, young people, and having the right pipeline in people. So the links are really going to be important to make. And finally, as WHO, for the past 5 years, we have convened a small countries network. And Cyprus is, of course, an active member of this network. And we are all the time looking at the specificities and the additional burdens and challenges that small countries face, as well as the opportunities and where they can actually, because of the agility, be leaders that larger countries can learn lessons from. So I wish to reiterate our full support for what you are doing. And through our Center on Primary Healthcare in Almaty, as well as the office in Copenhagen and in Barcelona on health financing, we stand ready to support and assist you technically as you and walk the journey with you.
Thank you very much, Professor Muscat. And I would like actually to close with these nice and optimistic words about support, about collaboration. And actually, I think that it's an evolutionary period. And since I am an optimistic person, I think this transition and this period would lead to an improvement of patient delivery care also in Cyprus. Thank you all very, very much.